If I told you that there was a habit you do for 8 hours every single day that is slowly cutting off the blood flow to your brain, damaging your arteries, and raising your risk of a stroke by up to 4 times, you would stop doing it immediately, wouldn't you? You would probably think I am talking about smoking or drinking or eating fried foods, but I am not. I am talking about what you are doing right now, or rather what you will be doing tonight when the lights go out. You spend 1/3 of your life in bed. We tend to think of sleep as a passive activity. We think I close my eyes and my body shuts down, but that is a myth. Sleep is an active, critical biological process. It is the time when your brain washes itself, when your heart repairs its vessels, and when your blood pressure resets. But for millions of seniors, sleep has become a battleground. There is a specific sleeping position, one that feels comfortable, one that you might have used since you were a child, that is silently twisting the delicate highways of your neck, crushing your airway and starving your brain of oxygen. No chest pain, no warning signs. You simply wake up feeling foggy, or with a headache, not realizing that you spent the last 8 hours fighting for air. As a health researcher, I need to have a serious conversation with you about your neck, your spine, and the #1 most dangerous sleeping position for stroke risk. Before we reveal the position, I want to ask you a question. When you wake up in the morning, how does your neck feel? Is it stiff? Do you have a dull headache at the base of your skull? If you answered yes, please listen closely. Your body is trying to warn you. Let's talk about the anatomy of a stroke. A stroke happens when blood flow to the brain is blocked. To get to your brain, blood has to travel up through your neck via 2 major systems, the carotid arteries in the front and the vertebral arteries in the back, which run right through the holes in your spine. Think of these arteries like a garden hose. If the hose is straight, the water flows powerfully and freely. But what happens if you twist that hose? What happens if you put a heavy rock on top of it? The flow stops. The pressure builds up behind the blockage. This brings us to the dangerous position, the position that twists the hose. It is stomach sleeping. If you are a stomach sleeper, I am sorry to tell you this, but you are putting your brain under immense stress. Think about the mechanics. It is physically impossible to sleep on your stomach with your face down in the pillow. You would suffocate. So what do? You twist your head. You turn your neck 90 degrees to the left or the right, and you hold it there. Imagine walking around during the day with your head turned all the way to the right, looking over your shoulder for 8 hours straight. You wouldn't do it. It would be excruciating. But when you sleep, you do exactly that. This extreme rotation compresses the vertebral arteries. It stretches the delicate lining of the blood vessels. In older adults, our blood vessels are not as elastic as they used to be. They can be a bit brittle. This twisting can cause what we call micro-traumas to the vessel walls. In rare but terrifying cases, it can lead to a dissection, a tear in the artery wall that causes a clot to form. And if that clot travels up, that is a stroke. But there is a second, more common danger to stomach sleeping, and it involves your lungs. When you lie on your stomach, you are compressing your rib cage. You are putting your body weight on top of your lungs and your heart. This means you have to work harder to take a breath. Your oxygen levels drop slightly. When oxygen drops, your heart has to pump harder to compensate. This keeps your blood pressure elevated all night long. Remember, night is when your blood pressure is supposed to dip. It is supposed to drop by 10 to 20% to give your heart a vacation. If you are twisting your neck and crushing your lungs, your blood pressure stays high. Chronic high blood pressure at night is the single biggest predictor of stroke. Now I know many of you are shouting at the screen right now, but I don't sleep on my stomach. I sleep on my back. I am safe. Not necessarily. There is a silent villain for back sleepers too. And this one is even more common. It is the high pillow trap. I see this in so many senior homes. You use 2, maybe 3 pillows. You prop yourself up because it helps with acid reflux. Or maybe you fall asleep watching TV. When your head is propped up too high, your chin is forced down toward your chest. We call this hyperflexion. Go ahead and try it right now. Tuck your chin all the way down to your chest. Now try to take a deep breath. Try to swallow. It is harder, isn't it? When you sleep like this, you are effectively kinking the airway. This is a primary trigger for obstructive sleep apnea. Sleep apnea is when your throat muscles collapse and you stop breathing for 10, 20, sometimes 40 seconds at a time. When you stop breathing, your oxygen plummets. Your brain panics. It shoots a surge of adrenaline into your blood to wake you up just enough to take a breath. Gasp! Snort! If this happens, you are not sleeping. You are drowning in air. This adrenaline surge cutting your blood pressure massively in. Doing this hundreds of times a night destroys the walls of your arteries. Seniors with untreated sleep apnea are nearly 3 times more likely to have a stroke than those who sleep with an open airway. So we have the twisted neck stomach sleeping and the kinked neck high pillow back sleeping. Both of these disrupt the flow. Both of these invite danger. But there is one more reason why alignment matters, and it is fascinating new science. It is called the glymphatic system. You have heard of the lymphatic system, which clears waste from your body. Well, your brain has its own cleaning crew called the glymphatic system. But here is the catch. It only works when you are asleep, and it works best when your spine is neutral. During deep sleep, your brain cells actually shrink a little bit to open up gaps, allowing spinal fluid to wash through and clear out the plaque, specifically amyloid beta, the protein linked to Alzheimer's and stroke-related dementia. If your neck is twisted, or if your jugular veins are compressed because of a bad position, that waste cannot drain out. It is like a clogged sink. The toxic waste stays in your brain. Over years, this buildup damages the brain tissue and weakens the vessels. So we understand the fear. We understand the mechanism. Now we must talk about the solution. How do we fix this tonight? We need to find the Goldilocks position. Not too twisted, not too flexed. Just right. The safest position for stroke prevention and brain health, according to most neurologists and sleep experts, is side sleeping, specifically on your left side. Why the left? It is a matter of gravity and anatomy. Your stomach is shaped like a kidney bean on your left side. When you sleep on the left, gastric acid stays in the stomach, preventing heartburn. But more importantly, sleeping on your side naturally keeps your airway open. The tongue falls forward, not backward. The throat stays clear. The snoring stops. Oxygen flows freely to the brain. But, and this is a big but, you cannot just roll onto your side and curl up into a tight ball. That is the fetal position, and that causes arthritis pain. You need to become a supported side sleeper. Here is the checklist for tonight. First, look at your pillow. The job of a pillow is not to be soft. It is to fill the gap. It needs to fill the exact space between your ear and the edge of your shoulder. If your pillow is too thin, your head tilts down, kinking the artery. If your pillow is too thick, your head tilts up, straining the neck. You want your nose to be in a straight line with your belly button, a neutral spine. When your spine is neutral, the garden hose is straight. The blood flows. The cleaning system works. Second, use the anchor pillow. This is a secret weapon. When you sleep on your side, put a pillow between your knees. This aligns your hips and takes the pressure off your lower back. It stops you from rolling onto your stomach in the middle of the night. It anchors you in safety. Now, what if you absolutely must sleep on your back? Maybe you have shoulder pain or you are recovering from surgery. You can sleep on your back, but you must ditch the stack of pillows. Switch to a thin pillow or a cervical pillow with a curve that supports the neck but lets the head rest back. You want your chin to point up slightly, opening the airway. And gravity is the enemy here for the tongue. So if you sleep on your back, elevating the head of the bed slightly with a wedge or adjustable base is better than bending your neck with pillows. I want to address a psychological hurdle here. Changing how you sleep is hard. It is really hard. You have been sleeping the same way for 60 or 70 years. Your body has muscle memory for that position. If you try to change tonight, you might toss and turn. You might feel frustrated. You might want to give up. Please don't. Think of it like physical therapy. It takes time. Start by spending just the first 20 minutes of the night in the new safe position. If you wake up in the old position, that's okay. Gently correct yourself. Over 2 or 3 weeks, your body will learn that this new position means safety. It means breath. There is a profound peace that comes from knowing you are protecting yourself. When you lie down tonight, I want you to visualize those arteries in your neck. Visualize them open, clear, and strong. Visualize the oxygen flowing to your brain like a healing river. You are not helpless. You are not a victim of your age. You are the pilot of your own vessel. I want to challenge you. Tonight, do the pillow audit. Go into your bedroom right now. Look at your pillow. Is it a flat pancake that offers no support? Is it a giant mountain that breaks your neck? Throw it out. Your brain is worth the investment of a decent pillow. And if you have a partner, ask them, do I stop breathing at night? Do I gasp? If the answer is yes, make that appointment with your doctor. A CPAP machine or a dental device is not a burden. It is a stroke prevention device. I want to hear from you in the comments. Be honest with me and with yourself. What position do you sleep in? Are you a stomach sleeper, a back sleeper with 3 pillows? Or are you already a side sleeper? Type side, back, or stomach in the comments below. Let's see which group is the largest. And if you are going to try to change tonight, add the word change. For example, stomach, change. I read every single comment, and I am rooting for you. Sleep is the foundation of your health. It is the time when you heal. Don't let it be the time when you hurt. Straighten your neck. Open your airway. Protect your brain. If you found this information vital, please hit the like button. It tells YouTube to show this video to more seniors who might be sleeping dangerously right now. And subscribe to the channel because in our next video, we are going to talk about the morning habits that can undo all this good work. Rest well, my friends. Sleep safe. And I will see you in the next video.